Okay, chapter 11, ACE 6th edition, Certified Personal Trainer Certification Textbook. And chapter 11 is on integrated exercise programming from evidence to practice. So and what I did was I actually put some tabs here so you can see really, really long chapter. Again, one of the longer chapters. However, just to give you a little bit of faith here that it's not as bad as it looks. Right here, this much of it is basically going to be what are known as case studies. So it's really about half of the chapter is material that, look, you're more than welcome to read. Obviously, it's always a good idea to read through, get an idea. But this is not really material that is needed for memorization for sure from a testing perspective. So this is really the material from chapter 11 that you're going to need to know. So of course, as always, paper, writing material, and writing implements so you can read it and rewrite it over and over. Say it out loud, of course. That helps. So chapter 11 is going to take some of the information from both the cardiorespiratory and the strength training components of the IFT model and put them into a little bit more realistic practice and give you samples and ideas of progressions, from a time perspective, what you'd be doing. So a lot of this is going to be rehash of what you've already gone through. So it should be helpful now. When you go through it, you're going to see a lot of information that you've already seen put into a more appropriate context of how you would actually train somebody, given, once again, given sort of an ideal sampling of what you would potentially do. So as before, if you look at what's in the chapter, evidence-based practice, this is the idea that we use information and research that has already been conducted. Pretty much everybody in the field agrees with the concepts and the ideas, and then the actual evidence that says this is the best way to do it. That's what evidence-based practice is really all about. In one sense, you do whatever you want to do, but is it really based on scientific evidence and information? And so what ACE is saying is that we have the evidence-based material here, and this is the best way to go about training people. And then, of course, programming for the 3 phases of the cardiovascular training program: base, fitness, and performance training. What would be a sample or interesting, ideal way, I guess you could say, to train people in this part of the IFT model? And then we also have the training program for muscular training, resistance training. Remember, functional movement, and then load speed training. You got to remember those 3 levels for each one: cardiorespiratory, right, base fitness, performance training, and then the muscular training part of it, right, on the other side of that mover method middle component: functional training, movement training, and then load speed training, as well as some information on periodization and program maintenance. And then they're going to finish it off with recovery. And then that's where literally the other half of the chapter is going to be on case studies. And so let's get started. Chapter 11, evidence-based practice. Again, you've seen this earlier on. It's just reiterating what you already should know and understand, is that when you're developing training programs, because that's what everything leads to, getting a training program for your client, you're looking at the client's needs, the assessments you've done with them, what your expertise and experience is, as well as research findings. All of them create this sort of perfect world where, when you take all of those into account, boom, here is evidence-based practice. And this is the idea. Figure 11.2 conceptually helps you to understand that you're simply trying to move people, or at least you are moving through a process to help your client achieve their goals. If you think about it, there's a simplicity to this, right? Client has a goal and they come to you, and there's things you need to do that are going to be most effective based on scientifically proven evidence to help them achieve those goals. And then as you move, once again, the ABC model, ABC. So ask open-ended, right? Ask open-ended questions so the client will talk to you more, develop rapport. B, break down barriers. This is the ABC approach in the mover methodology. And then C, collaborate, to help the client achieve their SMART goals, so to speak. Okay. And then the IFT model, cardiorespiratory training programming. And remember, there's 3 phases: base, fitness, performance. You should know that chart, that table, 11, 1. What is the focus for each one, and what's the ideal way ultimately that you're going to progress people through it. Base training has a training focus, and then program design. Nothing new here. You've read through this. Again, read through it. If you don't remember, just keep in mind, base training is all about VT1. This is where that heart rate level knowledge comes from. If you know what heart rate they reach that ventilatory threshold 1, that's where their training is going to be. Remember, base training is essentially all about getting people to increase duration and frequency at moderate training intensities. Low training intensity is basically just a little bit more than what we're doing right now, which is sitting here doing nothing. Moderate means that on a scale of 1 to 10, if you ask your client on a scale of 1 to 10, where are you at? Moderate intensities, 3 and 4, somewhere around that, getting closer to 5. But that's going to be a perceived exertion. We want to be more exact, obviously. So we want to do a VT1 submaximal talk test, and that's going to obviously involve the things you've seen and we've talked about in previous chapters. So if you know the VT1, you're going to have people train below that. Ultimately, we want them to train ideally every day. I mean, if they could, but for sure 3 to 5 days per week, and then get that frequency to 20 minutes, ideally to 30 minutes. So minimum of 20, 3 days a week minimum. That's what we're looking for folks to get into in the base training phase, sample based training. So here's where you want to kind of spend a little bit of time, be familiar with tables 11.2 and the subsequent tables that summarize for you the sample progressions. This obviously does not take into account the fact that your clients are going to miss workouts. They're not going to show, they're going to show up late or whatever the case is. Don't let the real life component of it get to you, because really what we're trying to do here in the chapter, like with anything else, is we want to know what the ideal is. We want to know what the best way to do this is. And if there are inconsistencies in people showing up for their workouts, showing up on time, those are just the realities of it. You take those into account. But this is the ideal sort of sample progression. In the fitness training, now we're going to be doing intervals into zone 2. Remember, zone 1 is below VT1. Zone 2 basically between VT1 and VT2, if you want to do that. And then above VT2 is zone 3. It makes it real simple. There are other ways you can do the zone. You can actually split between VT1 and VT2 and get that middle there. And there's a lot of ways you can do it, but for what we're doing here with ACE, it works out great. Very simple. And for the average person, it's perfect. So fitness training, we're going to start doing some intervals, and there's your training progressions. And that's what you got to look at from table 11.3. So again, sample fitness training progressions. Once you pass your exam, come back here, because this is meat and potatoes when it comes to actual real life training. This is the way I do it personally, and definitely the way I do it with clients, and of course using the next phase, performance training for athletes for sure. Again, understand the training focus and the basic components. the basic components to the training program itself. So the parameters, frequency, right, intensity, and then in this case, because we're talking about this higher level of performance training, there's multiple sequences that we want to work in within zone one, zone two, and then of course for zone three, if you're going to be doing that, there's even a column on recovery in this particular case. To say memorize this is I would hope goes without saying, because your ultimate goal is to understand why you would do these type of frequency and intensity parameters like this. So that's what you're going to get in table 11.4. And again, just understand program design at these levels these are samples. They're ideal. It'd be perfect if people actually came in and trained like this on a regular basis. You would actually see substantial changes. Of course, that table is really coming all the way into page 476, because this is going to bring us into zone 3 training. And just keep that in mind. It really, by the way, it really is important in the real world. This type of training, what you're seeing here is exactly on point. This is one of the ways we train athletes for what we call lactate buffering training, because that's what zone 3 is. Now, just as an aside, we do for advanced athletes, particularly endurance-based athletes, we actually do a 4-zone and sometimes a 5-zone training scenario where we break up zone 2. Normally we can break zone 2 up into its 2 separate zones, and then we'll break zone 3 up into 2 separate zones. So you could do VT1 below, VT1 and VT2, and then you could do VT2 and above broken into 2 separate zones where we hit 90 plus, 95 plus percent, where we're putting athletes into um, a much higher level of anaerobic lactate buffering type of training, very small percentage of time in there. And then the muscular training programming, which we kind of just looked at, functional movement, load and speed training. Those phases. And again, there it is to show you what they are on figure 11.6. And then, so now in the beginning components, right, we have the beginning phase is functional training. And, what is the focus? The idea is balance exercises, right? And stabilization, trying to develop flexibility, things like that. And the program design progressions are going to start out with developing core stabilization. One of the things you got to keep in mind with this training model is that you're not using resistance and weights right from the get-go. Okay, the idea, and by the way, this part of the model can last a week. It can last 2 weeks. For some people, it can last literally months. But the concept here is that this part needs to be done for pretty much anybody. You can have an athlete who's coming off of their season do functional training just as a way to come down off of this high level intensity, perhaps injury related type of potential that they've got into, because injury potential increases as you come into season. And then if they've really trained very hard, um, high level athletes really need to back it down depending on their sport. So one of the first things we're going to look at is core stabilization training, and that's what you're getting here on table 11.6. And then flexibility exercise, and trying to help individuals to increase range of motion if they have diminished or decreased range of motion. The 3 basic terms that you really need to know is elasticity, the ability of tissue to stretch and come back to its the normal physiological length, plasticity, and viscoelasticity. And that's all part of the flexibility paradigm. On page 481, you're going to go back into autogenic inhibition. Now, remember, we talked about this, but one of the things that's important is how it's actually applied in this type of training. And that's where 1, 2, 3, 4, 5, 6, 7, 8 bullet points are really, really important to read. So along with autogenic inhibition, remember there was not 20 things to remember. There was basically two really important things to consider and remember when we're talking about mechanoreceptors, muscle spindles, and GTOs, Golgi tendon organs, and that is autogenic inhibition. Remember, within the same muscle, GTOs, Golgi tendon organs, become active. When they become active, they deactivate the muscle spindles. Keep that in mind. Autogenic, single muscle, one muscle happening inside there, right? Then there's reciprocal inhibition, which always involves at least two muscles. Reciprocal inhibition is agonist antagonist relationship, right? Agonist is working, antagonist needs to shut down to allow for the movement of the agonist. Very interesting as a little aside is that when sometimes you'll watch Olympic sprinters, and if they pull a hamstring, for instance, there's some issues. But one of the things that can actually happen is that this neuromuscular relay doesn't happen fast enough, so that as soon as the quadricep, for instance, is which is the agonist during the recovery part of the initial forward movement of the leg after the step and pullback, right? So now the knee is going into extension to come forward. And as the quadricep contracts, if the hamstring does not have proper sequencing and timing for the release of tension, it can actually stay tight while the quadricep tightens up. If that happens simultaneously, the interesting thing is that the quadriceps are roughly by power output three, almost four, depends on the person, but roughly three times the overall power generation than the hamstrings. Guess who wins? The quads. So the quads pull, and the hamstrings try to pull against the quads. They're weaker than the quads. Boom, and they pull. So just an interesting way of understanding how this stuff actually works in the real world. So that's reciprocal inhibition. Um, your stretching techniques, then static stretching. Now, here we go. These are the practical ways in which we implement program designed for stretching. Static stretching, basically moving the muscle that you're trying to stretch into a lengthened position where you just start to feel tension and you hold it. Static, no movement. The muscle is lengthened. As soon as the muscle gets lengthened to a certain point, the muscle spindles activate. And remember, the muscle spindles do what? They contract, that they tell the muscle to tense up. Interesting thing about the muscle spindles, and that's called the stretch reflex. When I stretch a muscle too quickly, lengthen it too quickly, or I pull it to past a certain length, the muscle spindles become active and they tell the muscle to contract. Now, if I can get the muscle to a certain length where the muscle spindles are becoming more active and hold it after about 10, 10, 12, 15 seconds, sometimes a little bit longer, the muscle spindles start to down regulate and we get an ability for the muscle to lengthen a little more. Think about how cool that is, right? As long as you just sit there for a while, those muscle spindle fibers, which are really active and telling the muscle to contract, they start to slow down their neurological activation and they do what's called down regulate and the muscle relaxes and you can stretch it a little bit more, right? So that's called static stretching. If you can overcome the static or the stretch reflex, that's really all static stretching is doing. You are basically allowing for the muscle fibers to relax. At that point, here's the whole point of doing static stretching is now that lengthening, that continued lengthening actually occurs and puts stress and tension now on the connective tissue. So the fascia and the tendon. So now you have the muscle fibers have elongated, but now the tendons and the fascial covering, now they, particularly collagen fibers, which can get remodeled under this process. That's why it feels good, right? When you're stretching and you stretch out and you just sit there and it starts to feel good as the muscle lengthens. Well, now you're putting that elastic stretch and forcing the plasticity component of the tendon to come into play. And that realigns or lengthens and stretches out and lengthens the collagen fibers, which remodels them. And that's good. Then there's proprioceptive neuromuscular facilitation or PNF. And this is a method of stretching where you're actually utilizing these neurological components in the muscles to assist and help with lengthening the muscles. There's three basic processes in PNF stretching. One is called the hold, relax component. Then there's the contract, relax, and then the hold, relax with agonist contraction. Basically, what we're doing is we're trying to initiate autogenic inhibition, and there's ways to do that. And so when you read through those bullet points, very, very important because this is one of the most practical stretching techniques that's being used, and I highly recommend it because we do modified PNF stretching with clients. So then there's dynamic stretching. So static, no movement, dynamic movement. And the idea is that dynamic stretching along with ballistic stretching is basically movement. Dynamic stretching involves moving a limb in a controlled way so that when you take it to the end range of motion, you put a moderate slight stretch on the muscle. Ballistic is trying to increase speed to do it, like if you ever see swimmers. Okay, so if you ever see a swimmer before a race and they start throwing their arms back like that, that's ballistic. That's ballistic stretching, and they're doing all these movements and they're trying to, I don't know what they're trying to do, but they're using ballistic stretching apparently, but it should be done in a more controlled way, but whatever works, I guess, right? So now you've got table 11.7 and flexibility exercise evidence. So here are the recommendations. Now, once again, these tables in this particular chapter are critical to read through and know and memorize. Okay, so the FIT VP, right? Frequency, intensity, frequency, intensity, time, type, volume, pattern, and progression. Read through those. Very important because now you got table 11.7. And as you move through balance exercises, arm progressions, as well as surface. And basically what we're talking about here is arm progression simply means that the closer your arms are to the proximal part of your body, i.e. your midline, the easier from a balance perspective it's going to be. The further we move the arms out, positioning of the arms is going to incur balance demands that should be helpful and beneficial to your clients. Surface progressions, moving from flat, stable, the ground, for instance, to other surfaces that are not as stable. So you have Bosu balls. You can even stand on wobble boards. Things like this will afford a high level or need demand for balance while you're doing other movements. Visual progressions, and by the way, you can do this with 2 legs and then do 1 leg. You could do there's a whole number of things we can do. Balancing visual progressions. You can essentially eliminate visual cues by closing your eyes. Look, just keep in mind, these are just progressions. I'm not saying this is what we're doing in the real world, but these are ways that will affect the balancing demands on the vestibular system. Without visual cues, all your body has are these internal mechanoreceptors and other proprioceptive apparati that are letting you know where you are in time and space. But as soon as you close your eyes, that's all you got. It changes the ability to balance, and you can try it on your own. And then tasking progressions, which is basically moving from different types of exercises to others to make it more challenging balance wise. Here are your charts, tables. 11.8, right? Neuromotor exercise, balance exercise, training progressions. All of these are just packed with information. You should basically be able to look at each of these and understand, if not memorize, all of these balance exercises, evidence-based recommendations. And then you can move on to page 489. Now we're into movement training and the training focus, blend of neuromotor flexibility, muscular conditioning, right? In the movement training component. Again, program design. These are the progressions that you're going to see when it comes to this type of resistance exercise evidence-based recommendations. Table 1110, load, speed training, training focus, and program design. Again, read through these. There's nothing in here that's new. It's just a question of how it's being implemented into an actual program. Page 493. Now remember, once you get to load speed training, that's like the crossover. 99.9% of your clients are here in the first two phases. And then if they're athletically inclined or they have actual athletic demands or needs, or they're in really great condition, which I hope some of your clients are, now they move and they cross over into this third phase. Even though it's 1, 2, 3, it's really very different in a lot of ways, because you have to make sure that the client is really prepared and able to deal with the type of training program that you would ideally be moving them into. So they have to have a foundation of strength, joint integrity, mobility, and stability, adequate static balance, right? We tested those, remember, in the assessments, right? The single pedal movement, right? Where you lift one leg up, right? Dynamic balance, effective core function, all of those things that we'd love to get our trainers, our clients, excuse me, our clients to those points where we can now work them significantly harder. And then considerations for improving power. That's where table 11 comes in. So you can read through this, because now we're talking about plyometric training for the lower and upper body. Remember, you're not doing plyometric training with 99% of your clients, unless you deal with athletes. If you deal with athletes and plyometrics is an indicated type of training um, um, programming element, that's what you're going to do. But for the most part, by the way, not every athlete needs to do plyometric training. Okay, jumps and hops, and so that's where, because of the more specific way to train for plyometrics, that's why there's a lot more information here just on this component: proper technique, frequency, intensity. And you can see now we're going to be getting into periodization ultimately. So, when you're talking about plyometric training, there's a lot more you need to know, um, information wise and programming wise. And so as we move forward, lower body, here are some plyometric drills. Okay, it's not a bad idea to know them. Whether or not you see them on a test, is you're probably not going to see a lot, but it's important to know this, especially if you're going to be training athletes. um, and so now, as you move forward, continue forward, considerations for improve now SAQ, or speed, agility, quickness, reactivity, they call it. Um, Now you have some other information that you can read through. Again, table 1116, duration, energy system, interesting information for sure. Um, and again, if you were going to actually start training athletes and deal with athletes, this for sure is important information. So now, as you go from page 503, 504, you're getting basically agility, reactivity, quickness information. Of course, you can read through it. Memorizing it, not so much. Periodization, it's just a way of changing and moderating the intensity, the volume of training over a period of time. Normally, we do periodization schedules over an annual. Again, this comes from athletic training. Most athletes, of course, are going to train on an annual basis. They have a time frame where they're in season, right? Track and field, although track and field, of course, has an indoor season and an outdoor season. So they have to be prepped and ready if they're going to do both seasons twice during a year. But normally we're getting athletes prepped for 3 months, perhaps 4 months of their training season, some longer, some shorter. And then after that, we go through a conditioning or sort of drawdown phase, and then conditioning, and then a pre-season conditioning. It just depends on the athlete, depends on the coach. There's many different methodologies, but in here, the idea is that periodization is broken into two types, what we call linear periodization, where volume and intensity, right? As volume of training increases, we have a decrease in the intensity. When intensity increases, volume or load, amount, total rep sets, frequency of train, all those go down. So there is a offset here when it comes to volume and intensity. Undulating periodization, just basically you're changing those two parameters, intensity and volume, throughout the year. Normally, undulating periodization is what we would generally be using today. You could use linear periodization. That would be used if you're dealing with some high school athletes, things like that, where you can get them throughout the entire year. They're still working on training skills, things like that. Undulating periodization, especially for advanced athletes, is one of the ways that you modulate recovery, and you're able to ultimately make decisions about their training regimen based on recovery and how close they're getting to competition. Undulating just gives you more flexibility in how you periodize your training program. Macro cycles, the year, macro, right? Macro cycle broken into mesocycles, normally months or quarters or 2 months, whatever the mesocycle can be. Specific training goals for a 2-month period is what we're doing for the next 8 weeks. And this is our training. This is our goal for the 2 months of training, or this is our goal for the 3 months of training, or for the 1 month. And then that's broken down into a microcycle. It's intuitive. That's your actual workouts, right? So progressive training segments for each mesocycle. That's your workouts, right? So your microcycles are your actual training, each weekly training, blah blah blah. And you can create these periodization schedules. Most important thing about periodization is that you do it, right? You set up the schedule, and you don't allow the client, you don't allow the athlete to determine if they feel like they're going. No, physiology, right? The way someone feels is not a good indicator of what they should be doing. What you're doing is you're basing a schedule, annual schedule, monthly schedules, weekly workouts, based on what we know and what years of research and actual training has shown us to be effective. And then you would make modifications based on the individual athlete's recovery capabilities and their ability to be consistent and maintain their training. For the average client, you could set these up, but remember something about the average client. As good as this looks on paper, the reality is that people don't show up for workouts. People come in late for workouts. People go on vacations. Your goal ultimately is to understand this. That's the whole point. Understand all this, and then apply it as necessary and as appropriate for your clients. And so now you can get into program maintenance. What is program maintenance? Well, it's basically trying to help people to maintain continuous, consistent training over the long term. And so trying to get individuals um, to get into a training program, get consistent with it is great. If you can do that, you have accomplished a lot. Now the goal is to create a program maintenance component. And as they say, it's an underappreciated aspect of exercise, which is this continuous training that we want people to get into. So they don't train with you for 3 months and then drop off and never train again. We want to see them maintain their programming. And there's some strategies to that. Training strategy number one, the minimum dose of activity. To read through these, actually very interesting. Number two, low dose hit training. We're not saying, by the way, that people should do this. What we're saying is that these are the strategies when there is a possibility that your clients are not going to maintain their training. What you're letting them know is, look, the minimum dose of activity to maintain weight and cardiometabolic health equates to 1 mile a day. You train, train, train. Instead of stopping, walk a mile a day. That's basically what that's saying. Number two, 12 minutes a week of low dose, high intensity interval training. Strategy number three, integrate a single long training session into the biweekly training routine. These are just strategies. And training strategy number four is combined cardio and muscular training. Um, Honestly, that's one of the things that we highly recommend for people to do, especially those that have already demonstrated the inability to make it to the training sessions on time and who are constantly missing workouts, or for individuals that are only training with you once a week. We try to get everything in as much as we can into that one training session. It's one of the I would say, although it's last on a list, I would say that's probably in the real world, it's one of the most important things you can do. Get people to do their resistance training without a whole lot of rest in between, to get their cardiorespiratory system working simultaneously. Can they use as much weight? No, we're just happy they're training. So these are strategies to help with maintenance, and then of course recovery, the overall uh, post-exercise recovery, right? So these are vital. Obviously, people have to recover before they move into their next workout. In one sense, recovery is a concept all on its own that can have its own completely separate chapter. Exercise program fit, right? Frequency, intensity, type, time for accelerating recovery. The idea is to optimize recovery, okay, by managing various components of recovery. Active recovery is an effective way to reduce the overall recovery time, but still get the appropriate metabolic um, recuperation that's needed. Frequency of recovery, intensity of recovery. This is often overlooked, misunderstood component. Time and duration of recovery, and type. Practical applications, again, good information summarized for you in figure 11:10. There's your summary. Read through it, of course, but that's going to be your summary right there. Practical applications then. And so program active recovery. Again, this is all about recovery. And you'll notice that ACE has taken some time to say, look, recovery is actually probably more important than most people even appreciate. Um, Program high intensity interval training, recovering from that. This is a really good expand your knowledge box. Highly recommend you read this on page 516, 517. And then, of course, in one sense, we're done with the chapter when it comes to the material that you need to actually learn, and particularly from a testing perspective. The rest of the chapter right here is on case studies. And then real quick, what they've done for you is they've basically given you a scenario. They're going to give you a scenario and then show you through their mover method ABC approach, ways you could deal with this type of individual and the progression. It's not a bad idea, at least to look through it. Um, they give you a person, they give you goals, they give you all of this information, and then they show you here's a way that you could, based on everything that's been discussed, here's a way that you can actually train these individuals in a progressive way, right? So you have this individual, right? She's done, and then you come through the movement method. You have a warehouse worker with a history, shoulder problems. Again, really good information. I'll be honest with you. I would highly recommend, if you have the time, then to go through it and kind of read through it, and see what they recommend as far as communication and how you're going to approach the client and help and assist, and see what their actual programming looks like. And then that's going to be the end of chapter 11. Now, when we move into chapter 12, that's section 4 of the book itself, of the textbook itself. And that's going to be program modifications. It's really looking at special considerations for clients, special population. Sometimes it's called, but this is modifications. That's what section 4 is, for special considerations, i.e. obesity. Chapter 13 will be chronic diseases. Chapter 14, across the lifespan, of course, when we will get into that, and then clients with musculoskeletal issues. So again, end of chapter 11, a lot of great information in there, and I look forward to seeing you chapter 12.